Hi everybody, it's Dr. Sandra Laura Cremers, and I wanted to share with you a question that I get asked almost every day now. A friend just texted me this question, and so the question is, I just have this amazing setup at work. What do you think about it for my eyes? And so I just wanted to show everybody what I think about it. So this is the picture my friend sent me. You guys can kind of see that he has all these monitors on his screen here, and he's asking what do I think about it for his eyes. Well, many of you know that I see a lot of patients with dry eyes, and it's becoming a big issue for us. And I think you've heard me say that when I was attending at Harvard, I probably saw a few patients a year that had dry eyes, or what we knew at that time was dry eyes, in preparation for cataract surgery, and they most of them were over 70 years old, and now we're seeing a lot of young people with dry eyes, and it's very upsetting. So my advice always is to minimize your screen time. Close your eyes when you're talking sometimes, or blinking a lot at the screens is very helpful. And I want to show you what I'm talking about exactly when I'm talking about the importance of blinking and minimizing your screen time. So the reason why screens are very bad for the eyes, there's two key things. The first one, where I think I'm 100% sure about, we're trying to get published, is the effect of the screens on your meibomian glands. These are the oil glands along your eyelids that produce oil. When you're at a screen, people tend to not blink. You tend to stare. People don't blink that much. They don't close their eyes when they're on the screen or focused. And when you don't blink, you don't milk the oil out of the oil gland. And I'll show you what happens in just a moment. The second issue is the blue light, and we're all very concerned about the blue light affecting the macula, because we're not going to know the effect in terms of large-scale issues or epidemics for about another maybe 20 years, we think. So I'm starting to recommend more and more blue light filters. Lux is an app that I have on my screens to decrease that blue light, especially in the evening, which can affect your REM sleep and anxiety and poor sleeping. But most importantly is for kids and the blue light on their macula. So really try to limit screens. Let me show you, going back to the first thing, is what the gland should look like. Let's see if this can hold up here. So this is our picture of the meibomian glands that we show patients. And so here you'll see these white lines which look like piano keys. That's filled with oil, and that's the way the gland should look until you're long gone. I have patients that are 90 years old. I just saw a wonderful friend of mine yesterday who's 87. Her glands look like this. She's never had an iPhone. She just got a computer. And so, she looks great. She looks normal. And then if somebody starts to develop scar tissue, or they start to lose a gland, they can sometimes start to have symptoms. And some of the first symptoms are early foreign body sensation or tearing, sometimes redness, aching. I've had some people say they have a headache when they come in, or they have an aching sensation, or they feel like there's something behind the eye. And the number one cause is something wrong with the oil glands. When patients look like this, where they've lost even more glands, these patients sometimes can really have chronic pain, even 24-hour pain. A lot of those patients that I have will wake up even at nighttime to put drops in, or they're really miserable. So it's important to save the glands. It's important to minimize your screen time, important to minimize screens in general, because we're all using them, and we're starting to see more and more young people coming in like this. I have a couple of 6-year-olds that look like this, and they started their iPad when they were very young as their babysitter, and now they're having really big problems. So definitely minimize your screen time. Definitely blink when you're on the screen. Look away. Talk with your eyes closed if you can. Anything to minimize the screen time and get the oil pumping. So I hope all of you will think about that. Encourage your loved ones, especially your kids, to not have a setup like this if they can help it. Of course, you need it for work, but definitely take breaks and decrease, not so big screens, less blue light. Maybe get blue light filtered glasses that will filter out the blue light, but just be aware of that. Anyway, I hope that helps. If you have any comments or questions, please let me know. You can post it on my Facebook. Okay, have a good day. Bye.